Hi, Mr. Johnson. We provide for privacy. My name is Debbie. I'll be your nurse today. I have an order that we're going to access your port. So I'll be just making sure the placement is good, and you have a standard port, so I'm going to use a 0.8 inch needle to access it. And can you verify your name, date of birth? Okay, thank you. I'd put him in supine position. I'm going to raise the bed up for good body mechanics. Really. And lower the rail. Just hand hygiene. And my exam gloves. Make sure the port is still in position. That's not flat. Is that tender, very tender? Not too bad? Okay. All right, so it's in good position. So I'm gonna go ahead and get my kit ready. Lay out my sterile field. Have my tape here. I'm just gonna put over here inside, and I'm gonna place a mask on you, and I will be wearing one as well, just to keep the field good and clean. If you have any trouble, then just keep your head turned to the side. I will also put one on to get my sterile gloves on. I'll touch the outside. And get this one right here. I'm going to go ahead and get my needle ready to flush. So I'm going to open the clamp and also I'm going to be holding a few things here. I've got my port. This, I'm going to step away from the bed and prime it. And there we go. So that is ready. I'm going to place it back on my sterile tray. And I'm going to break this, and we're going to clean crosshatch for at least 30 seconds. Scrubbing vigorously. So, okay, got that done. And now have this clamped. I'm going to go straight down over it. Keep it from, hold it, and I hit the back, clamp it down. Okay, I'm going to unclamp it. I'm going to flush, do blood return, aspirate for blood return, and I've got it. Now, I'm going to flush up to 10 or 9.5, one at a time. 1 millimeter at a time, milliliter, and I'll continue this until I have just a half left. I'm going to clamp it. And take that off. Lay this right here. Get my bandage dressing ready. And
hey, good morning, Mr. Jones. My name is Frankie. I'm a nurse today. How are you? Awesome. All right.
I'm going to start it down in the center.
Can you just verify your name and date of birth for me? Thank you so much.
Pushing down and out so that there's no bubbles.
Is it a good time to go ahead with this procedure? That's going to make sure that you're in a good position, you're comfortable with the bathroom.
Around. We've got that. Put this off. I'm going to save my little label on here to put my date. Just double check everything, and I'm going to tape around all 4 sides. And I'm also going to tape this up here where it's not just flopping around.
Checking my expiration dates on my materials here.
I've got my sticker here. I'm going to write my date, which is 3/20/24 at 6 p.m. My initials. Put this across here. I'm going to document that I had assessed the site. I used sterile technique, placed a 20 gauge safety needle in, 0.8 inches long. I'm going to document that the patient tolerated well. I will return the bed to position. Put the handrail guardrail up, and make sure call light's in place. Clean up my equipment, and make sure all of his possessions are within and there's no cords laying around for her to be tripped on.